Anyone with atrial fibrillation who is being asked to consider ablation therapy ought to keep a couple of important facts in mind. First, the success rate of the procedure, while reasonably good, is not measurably better than it is with anti-arrhythmic drugs, at least, not after a single ablation procedure. Second, there is a very slight risk of serious complications. Despite these limitations, it is entirely reasonable to consider an ablation procedure if your atrial fibrillation is producing symptoms that disrupt your life, especially if 1 or 2 trials of anti-arrhythmic drugs have failed. Just be sure that if you are considering an ablation procedure for A-fib, you make yourself aware of all your treatment options for this arrhythmia. If ablation is still an attractive option for you, you will want to make sure you optimize your odds of a successful procedure. This means knowing your electrophysiologist's personal experience with ablation procedures for atrial fibrillation. Don't settle for a recitation of statistics from the published medical literature, which are generally reported only by the very best centers. Your odds of a good outcome are improved if your healthcare provider has a lot of experience and has a good safety record and good past results with ablation procedures for atrial fibrillation.